All right then. So I guess we'll go ahead and get started. Good afternoon, everyone. My name is Dr. Martinique Jones, and I am one of the Division 17 Early Career Professionals Committee members. Myself, alongside with Dr. Alexandra Maneri, will be presenting today. Allie, wait. Hello. We're going to be presenting the third of our ongoing virtual connection and development series that's affiliated with the division. So just to give you a brief overview, the Virtual Connection and Development Series was developed by members of the Division 17 Early Career Professionals Committee for the purposes of presenting timely and relevant networking and professional development opportunities for early professionals. And so during our 60 minutes today, we're going to be focusing on the clinical job search. And in particular, this webinar will address a broad range of topics associated with the clinical job search, focusing on perspectives of clinicians in university counseling centers, community mental health agencies, and VA administrations. The specific topics that will be addressed include obtaining licensure, determining which clinical settings align with your personal and professional goals, as well as identifying skills for interviewing successfully. Just to give you a brief outline of what we'll be doing today, I'll first start by giving you an overview of the biographies of our presenters. So we have a set of 3 presenters who are well-accomplished early career professionals that are housed within clinical settings. So I'll tell you a little bit about each one of our panelists. Then we'll go through the content for today, as I mentioned, talking about licensure, talking about selecting a job, as well as talking about interviewing. And then we'll conclude our webinar today with a set of questions. So if you have questions for the panelists, you can go ahead and use the chat function and send those messages to us, and we will field those questions to our panelists. So as you're listening today, kind of keep the questions in the back of your mind, and hopefully we can address them at the end of this webinar. Also, for those of you who are here today, great. You may know someone who was unable to attend the webinar for today, and in that case, we would like to let you know that this webinar will be available on the Division 17 website, so you can access it later, as well as any of the content that we have for today. Also, you can contact Allie or I if you have any specific questions that may peak after the conclusion of the webinar today. So with that, all that being said, let me go ahead and introduce our panelists for today. In alphabetical order, I'm going to start with Dr. Jenny Bannister. So Dr. Jenny Bannister is a staff psychologist at the James A. Haley Veterans Hospital in Tampa, Florida. Clinically, Dr. Bannister's interests include trauma, inclusion of partners and families in the treatment of PTSD, moral emotions, adjunctive sleep treatments, and comorbid PTSD and substance use disorders. Her research interests include PTSD, adult attachment, moral emotions, and differences by gender and trauma experiences. So that is Dr. Bannister. The second panelist that we have today is Dr. Gabrielle Jones. She is a licensed clinical psychologist in the Chemical Dependency Department at Kaiser Permanente. She is also a professor at UC Berkeley Extension and teaches the foundations of addiction for their drug and alcohol certification program. Additionally, Dr. Jones conducts psychological evaluations for Santa Clara County Juvenile Corrections. Dr. Jones is specifically interested in adolescent substance use, co-occurring disorders, and substance use program development. Dr. Jones is also routinely contracted to provide in-service substance use trainings for organizations that provide services to adolescents. So that is Dr. Jones. Finally, our third panelist is not with us today, but she will be joining us very shortly. Our third panelist is Dr. Brandy Pritchett-Johnson, also referred to as Dr. Brandy. She is a fully licensed psychologist, wife, mother, educator, trainer, speaker, and lots more. She is the owner of the Diane Morgan Group, a therapy and consulting firm. Dr. Brandy also serves as the founder and the executive director for Future for Teens, a nonprofit organization with a commitment to serve vulnerable communities by integrating educational and mental health services. Additionally, Dr. Brandy has worked at the University of Florida, Ohio University, Western Michigan University, and Kalamazoo College in a variety of practice-oriented roles. So that is our final panelist, Dr. Pritchett-Johnson. So at this time, I want to go ahead and transition things over to Allie, and she'll go ahead and get us started with our panelists.
Thank you for that Really awesome overview, Marty. I appreciate it. And thank you again to our panelists for willingness to kind of share their experiences. So now we're going to kind of transition and again hear a little bit from our panelists about their current experiences as well as kind of what got them into their experiences. So we'll start by talking about where they're at now, and then we'll talk a little bit about the interview and application process. Doctors Bannister and Jones, if you could talk a little bit about both like the type of setting that you work right now and what particular key aspects of the setting that you're in that led to you pursuing this particular opportunity.
I don't know if you have a preference of who to start. I can go ahead and jump in. So I'm at a VA in Tampa. I'm in a PTSD clinic. And for me, this choice was pretty easy. I pretty much started graduate school very interested in the VA setting, and was able to kind of do internship, postdoc, and then segue into a PTSD clinic job. So for me, it was pretty straightforward.
And for myself, my current setting is adjacent to Kaiser Permanente Hospital. So I work in the outpatient chemical dependency department, and sometimes I'll work in the emergency department fielding chemical dependent clients. And I got there a little different. I started out at Oklahoma State and I did juvenile corrections there. And I was really interested in that. And I recognized that throughout my training, there was a thread of substance use and chemical dependency. So when I did community mental health for internship and even in the counseling center at OSU, I saw that there was a lot of substance use and that wasn't being addressed. And it kind of led me into chemical dependency and substance use, and I've loved it.
Thank you both for that. Dr. Bannister, you spoke a little bit to this. I'm not quite sure where this falls in your trajectory, Dr. Jones, but can you both speak to decisions about like following internship, decisions about pursuing a postdoc versus maybe not pursuing a postdoc, and kind of how you navigated that for yourself?
Sure. So for me, that was kind of a non-negotiable that I was going to be going on from an internship to postdoc, largely because of getting licensed and getting into my setting. That made the most sense, but also just really kind of wanting additional experience beyond kind of the intern sampling that I got. I was able to do lots of different things, but I didn't feel expert in anything. And it was very interesting how much I felt expert after kind of having the 1 year in my postdoc setting. I also was able to sample, so I've been PTSD throughout, was able to do some sleep intervention, PTSD, get some DBT experience, and kind of get all of those things, but not at a level that I really felt good transitioning into a job, and also wanted to get some substance abuse PTSD experience. So that's why I decided to look for fellowships that direction, and really kind of immerse myself and then launch into a job. And so it was interesting, at the end of postdoc, the reason why I knew that I was kind of ready to be staff psychologist versus not, was just kind of feeling irritated with my supervisor giving feedback and feeling like, got this, I'm good, which I expected it to feel like more exciting or emergent. And it was just kind of one of those, nope, I'm good, I'm ready. And so coming into this job now, I don't feel imposter syndrome most days. And I think that would have been very different had I done it without an internship, even though that's possible in the VA setting. Some people will hire you straight out of internship and you get your licensure hours through being under supervision. So it's possible, but I wouldn't personally recommend it.
Thank you.
Yeah, to echo Dr. Bannister, it was a non-negotiable. I think for licensure, it's a lot more streamlined if you do a postdoc to get your clinical hours and to be prepared for licensure, as well as prepared to be staff psychologist in a clinical setting. I think specifically for me, I wanted to work in the Kaiser system. I wanted to work in a hospital setting. And in Northern California, almost all of the hospitals have a formal postdoc. and that's how they hire. They really want to hire their postdocs. So knowing that I wanted to be in Kaiser, not necessarily sure if I wanted to specialize in chemical dependency versus general family or general adult, I still wanted to have a postdoc so that I could get a foot in the door. So that was a really key part of being able to stay in Kaiser, learn the system, be under someone's supervision that first year to kind of transition. And then similar to Dr. Bannister, it kind of alleviated that imposter syndrome when I got into being able to say, this is my specialization, this is what I'm doing, this is what I'm familiar with, this is what I know, this is what I'm confident about. So had I not done a postdoc, there definitely is still opportunity at Kaiser and other hospitals to be a psychological assistant, but those are much farther and fewer between when it comes to clinical work.
Yeah. I appreciate you both describing that, recognizing that in some ways there were kind of personal development processes that led to that, the recognizing that it can help with that identity development of like stepping into the role of a psychologist, and really kind of fully embracing that, while also recognizing that whether it's the particular setting that you're in or even the different state that you work in, sometimes it's actually a requirement. So I really appreciate you both kind of speaking to both pieces of those and how that informed your decisions.
I have one question, a follow-up question related to that. As Ali, you just mentioned the idea of identity development and really solidifying your identity as a psychologist. At this postdoctoral or even at the internship juncture, did you all know that you wanted to pursue clinical work? Or did you ever consider academia, or were you grappling in that way with your professional identity? Or did you both know, yes, I want to pursue this clinical work and therefore I need to get licensed and pursue X, Y, and Z steps?
That's a great question.
I knew for a fact that I was headed into some degree of clinical work, if not complete. So did a VA internship, did a VA postdoc, and had the goal of hopefully getting a VA job, coming up with other options in case that didn't happen. But kind of making sure and having those pieces in my mind throughout were definitely a piece from the get-go.
Mm-hmm.
I also knew that I wanted to do clinical work initially, but I found as I've kind of developed that my clinical work has given me more opportunities to get into academia without having the research backing that I need for academia. So I adjunct actually, and I've been getting opportunities to adjunct in substance use and chemical dependency at various schools in the Bay Area because of the fact that I have such a wealth of experience clinically. So that ended up serving me well and being a benefit for me in getting into academia from another direction, because I really do enjoy teaching. But I didn't realize that the clinical work they can go hand in hand depending on how you want your career to look. So I actually am in both worlds now, and I like it because my teaching informs my clinical work, and then my clinical work informs my teaching, and I can kind of draw on both. And I think it makes for a richer experience for my students and my clients.
Absolutely. Yeah. So now that you are kind of solidly in the positions that you've kind of told us a little bit about the trajectory that got you there. Can you talk a little bit about some of the aspects of your job that you really appreciate, that as you think about somebody maybe considering that type of position, you'd want them to consider, as well as things that maybe feel a little bit more challenging? And in asking that question, I recognize sometimes that's kind of personal factors, so hours, or like the length of the day, or it could also be like center factors, so like the type of work that you get to do, the different clientele. So kind of both of those.
So I'll aim to speak to this more broadly because a lot of it goes into like the PTSD work that I get to do that I love. But I feel like within the VA, there's a lot of options of what you can do because there's such an overwhelming need. And so if you have these very specific interests, my experience has been that I've been able to do a lot of different things that I'm excited about. And I love that. And there's kind of a wealth of different trauma interventions that I enjoy that I've had no issue kind of advocating to do, because there's just kind of overwhelmingly a need regardless. So there's that. For me, I'm back home. Tampa Bay area is home for me. So I was able to get back into the same area that feels very cozy and very familiar. I also have colleagues that I've worked with in other settings, so that's been quite enjoyable. And I think probably something that's a VA thing as well, because you're going to be doing internship and postdoc where it's likely then you're going to get a job with people that you've already worked with in various different settings. With regard to challenges, I work in the VA. And so a few different examples of that even this week is, we had somebody that was replaced within the government that's overseeing all of the VA. And so with that brings uncertainty of how policies are going to change. Being staff have seen kind of a different side of just kind of how these policies get sorted down, where sometimes there's not a whole lot of directive about what to do or how to do certain things. And as a frontline provider, you're having to kind of cope with all of that, and it's constantly getting fired at you, where we're having to kind of decide, how do we implement this? What do we do with this? And so that's tough, that's challenging. And then the VA is very paramilitary. And so because of that, you're often operating in a way that feels similar to the military. So I have a tour of duty. And I have to put in all kinds of paperwork and all of that to change my tour of duty and have multiple approvals and things of that nature, where other settings you might not have kind of that same rule rigidity that tends to happen in a paramilitary organization. So lots of, I think what's pulled me more the direction of staying in the VA really is just, you've got a lot of resources that come all together. I've got my CEUs that I can easily get here for free. I have colleagues I can consult with that are specialty expertise in lots of different ways that if I went, other avenues, I probably wouldn't have access to the same amount of resources. So pros and cons, lots of them.
Thank you.
I will start with the cons and then go into the pros. I think one of the biggest cons with working for a hospital is insurance. So I experience a lot, especially with chemical dependency. There's an etch out for that with Medicaid and Medicare. So people will come in looking for services and they can receive services in one department but not another because they have Medi-Cal insurance. And so referring them out is really frustrating because Kaiser is supposed to be this, agency that is a one-stop shop. And in more ways than one, it is. However, depending on what policy changes and what insurance looks like, insurance coverage changes, that really has an impact on our population. Also, working at a hospital is more intervention work than it is prevention work. So people often come in and they've already been diagnosed with a substance use disorder, or they've already had an overdose, or they're coming out of the hospital. So it's really difficult to do that preventative work that a lot of us are really passionate about. And going out into the community, Kaiser is a very large agency. So going out into the probation departments and the schools is more difficult because, again, all of those people don't have Kaiser insurance. So giving them the resources and the information is limited to those who actually have that insurance. So that's challenging too. And we have a very high demand. So in Kaiser, there's the chemical dependency department is etched out from the rest of mental health. So we don't have as much of an issue with this, but in the mental health department, there's such an influx of patient need that their appointments tend to be really far out for individual appointments. So Kaiser's really good for depression, anxiety, PTSD, things like that because of the group model, or, we have DBT, we have ACT. There are a lot of good group opportunities. But for the general layperson who just wants To see someone once a week, Kaiser is probably not the place that you'll want to go for that. You want to go for more specific, consistent, and group work with intermittent individual therapy. Chemical dependency is not like that. I have a lot more availability in that regard. I can see my clients more often, and I see them in their groups. Some benefits are the advocacy. We really are able to advocate for ourselves as clinicians, for our pay, for our insurance, for our hours. We can advocate on behalf of our clients to get more appointments, to get more clinicians in. And then also program development. I think one thing a lot of people don't know about Kaiser is every single facility is different. So you can create whatever your heart desires in terms of a program. If you are passionate about PTSD, or if you're passionate about bipolar disorder, you can create some program to work with that. If you're passionate about trauma in men, you can create a program that's specific for that. And so a lot of people don't know that about Kaiser, but I love being able to engage in program development at that level in that regard.
It's helpful to hear all the different complexities and considerations, like as you think about being in those positions. So I really appreciate you both speaking to all of that. And even as you talk about it, can for sure see the energy that you have and the enthusiasm you have around the really positive parts of the position, while holding some of the tougher pieces. So again, thank you for that. Recognizing that there was a kind of process to kind of help you get to that position, we did want to, at this point, I'd like to transition and think through with you a little bit more about the interviewing process. Recognizing that the interviewing process for the VA maybe looks a little bit different for hospital setting, and then also recognizing that there are other clinical settings where there's some nuances to it. I wonder if maybe you can both start by talking a little bit first about the application process, and both recognizing that, like, I realize a lot of times it's typically like a cover letter, your vita, as well as references, sometimes letters, sometimes even just kind of indicating like who your references are. But if you could maybe talk a little bit about like both like literally what that entailed, but also what you noticed helped you be successful. So like what additional, like what guidance within that application process would you give to applicants who are thinking about that right now? And then after we talk about that, we'll transition to the interview process.
So what the formal guidance is very different than what my experience was with finding a job. So USAJOBS is the way that you'll see everything advertised for staff psychologist positions. However, not everything has to be posted on USAJOBS. So USAJOBS is kind of that central place for anything that's a government-related position. You can go in and set up alerts and say that you're looking for positions, say, throughout California, and it's going to email you whatever you specify with all the positions that are listed. However, within a VA, not all positions have to be listed. Sometimes they can recruit internally. Sometimes they don't recruit internally, but like they prefer to, so the job gets posted for a week. And so there's a lot of nuances there. And so to some degree, it's a matter of looking on USAJOBS, putting together your CV, doing the cover letter, filling out the application there. But a lot of it's kind of the back end work as well. Is for me, it was most helpful that people knew what I was looking for. Both positions that I applied for, I applied for two, got the one here, came home, and both of them were put on my radar by other people that knew what I was looking for and said, you need to try to apply for this. So although with the one, I did do the formal USAJOBS application, it was actually much more about contacting the site directly, knowing who to email with my cover letter and with my CV, and having people kind of on the inside helping with those things. So that would be probably my strongest recommendation is, of course, have a polished cover letter pretty ready to go. within the VA, you're not having to tweak it too much depending on what you're looking for. CV, again, also pretty straightforward. But most importantly, having people look and see the listservs of what's coming up for jobs, or know internally what's coming up to like even know to apply is kind of a bigger thing. Because my job, I wouldn't have known about if it weren't for kind of that back channel piece. So.
Most of the hospitals here have their own portal for applications. And I would say that's probably the first thing you'll want to do is find the application or find the position that you're looking for and apply. One of the things that I wish I would have known maybe 3 or 4 years ago was that I needed 10 years worth of information on all of the things I did, how much I got paid, and just very minute details that I wasn't keeping track of as closely as I should have been. So I assume that that's the case for the VA too. Like specifically, they're looking for the past 10 years of your experience, things of that nature. So that would be something that I would recommend doing, just keeping pretty close tabs on what you were doing, whether it's volunteer work or not, because they will look at the gaps. They will look at your volunteer experience. And then similar to what Dr. Bannister had mentioned about having someone on the inside, the hospital positions tend to have the hiring manager listed or the recruiter listed, and you can contact that person directly. I would recommend the hiring manager contacting directly, just saying, hey, I applied for this position, because it does get filtered through the recruiter and then sent to the hiring manager. So it doesn't necessarily go straight to the hiring manager. Sometimes the recruiter will bypass the application if they don't see specific requirements. But if the hiring manager knows to tell the recruiter about your name, then you're more likely to get a foot in the door for that interview. With Kaiser, like I said, they really like to hire their postdocs. They really like to hire people who have already been Kaiserized. So knowing the system, knowing the electronic health records, knowing your way around Kaiser is really helpful. And any big system or agency, they want you to have that experience. So if you know somebody on the inside, connect with them, have them virtually introduce you, but I'll always fill out the application first so that it's already there and you don't have to have someone tell you to fill out the application. I can't hear you, Alexandria.
Thank you. I was on mute. I appreciate you both speaking to kind of what you have already, and acknowledging again some of the lessons learned through the process. Had I gone back in time, I would have collected all these more nuanced pieces of information. That's so helpful for our attendees to hear. There's something that you both mentioned about essentially knowing somebody and kind of having an ongoing relationship with somebody who can update you about available positions that I just think is really key. I wonder if you can talk a little bit to maybe ways that I don't know if the language you would use is promote yourself or advocate for yourself, kind of as you're going through this process. How did the two of you handle that?
It's a good question. I don't know if I was intentional about it. But I was at postdoc in San Diego at the VA there. And so it's a very large cohort of folks. But it's a large cohort that we're moving together consistently through trainings and whatnot. Can you still hear me? I'm getting a weird signal on my end.
I can still hear you.
Yes. Okay. So because of that, just being consistent in what I was looking for, people knew that I was interested in going back to Florida or being in California. And so, I don't know, everybody was pretty good about just being thoughtful and knowing what your specialty was because of how the postdoc worked. You were in your specialty. And so we were all kind of just advocating for each other. I think that some of it really, at least from what I experienced from the VA, was I had my peers' backs because I wanted them to get something that they're really happy with. And they had mine. And I think just that camaraderie where like you're genuinely trying to help each other creates an environment where you're going to be likely to hear about things. So, I mean, I maybe could have advocated better for myself, but I think it was just my message was pretty consistent because I knew what I was looking for. So.
Thank you.
I would say that if you're looking for a particular position, if they have an open house, then you should definitely go to it. Mm-hmm. So we had the hospitals out here had open houses, and I would try my best to get to all of them just so that I could meet the training directors, I could meet the managers, I could meet the staff, and really advocate for myself in that way. Once I got into the system, the managers go to manager meetings regionally. So telling my manager, to talk to the manager that I had applied for a position for was helpful. And then I have a couple of other, positions in the community, and that was all by word of mouth. So if you always have your business card on hand and you let people know what you're doing and what you're interested in, if you go to those events, more often than not, that's where I ended up finding out that people had positions open in teaching or doing assessments or a training. So being involved really helped with regard to developing and molding my career. People knew what I did, they knew what I liked, and they had my information, so they would contact me. Mm-hmm. And that ended up being really helpful in getting me to where I am.
Yeah, thank you both for that. I also noticed, I'm wondering if our third panelist has joined us.
I have. I'm so excited I made it. Dr. Brandy on the line.
Thank you. Thank you for joining us. And I wonder, I definitely do not want to put you on the spot, but I just want to give you a quick update about where we're at. And then if you want to speak to like your response to this, or I can also ask the panelists the next question and you can kind of dive in then. But just so you're aware, yeah, so we're kind of at the point where we've talked a little bit about kind of the interview process and what that's looked like. So if you could maybe speak to both kind of like, if you could just kind of quickly share maybe where you're at, but then also kind of what that process was like in terms of application materials that you used to apply to the position that you have right now. And then we'll kind of transition and talk, then after that, we'll talk a little bit about interviewing things.
Sure. Thank you all for having me. I'm excited to talk about the topic. I can share, and I'll be really concise. So my career background is, as my most former role was as a clinical assistant professor at the University of Florida. So that academia, non-research setting. I was a clinician primarily and engaged in quite a bit of outreach and consultation as well. So I can speak from that perspective as far as job talk and application, that experience. And then I've also had a considerable, at this point, amount of work in private practice. And most recently, where I am right now, over the last year, I actually resigned from my role at the University of Florida and decided to focus on my private practice consulting firm, and then also the nonprofit that I established over now 10 years ago. So I'm full-time in both the nonprofit and private practice sector at this point. I'll share this as well because you asked about application materials. For my current position, there was no application as much as it was just that kind of jumping out in the entrepreneurship role. But what I can speak to, if it's of interest to those on the webinar, participating in the webinar, is how I've had to learn how to market myself a bit differently in the private practice sector as well as the consulting realm. So I have had a number of contracts with other local nonprofits. I do often engage in providing CE opportunities for counseling centers, and then also the nonprofit world as well. It's a very collaborative nonprofit, so there are marketing and, dare I say, application things I have to do there to get the job, to get the contract.
That's really helpful, and I think in some ways maybe lends itself well to the next question. Thinking about essentially, like, once you've submitted the application pieces, how do you engage with the folks who are going to potentially hire you to actually get the job? So I wonder if you all can speak to essentially the interview process. So I mean, you're welcome to kind of give an overview of the process, including like any kind of pre-screening that maybe happened from afar, whether that was over the phone, via Skype, and if there was any kind of in-person interview. So talking both about what that process was like, maybe how you prepared, and then any tips that you might have for the folks who are listening.
So this one is very specific in the VA and then very variable. There is performance-based interviewing, which I'd imagine might be in other hospital settings as well. But you are required to essentially have a very structured interview with the same amount of time to answer the same amount of questions in the same order given to each applicant, with the goal of being able to standardize how people are getting rated. And so with those, you're really having to demonstrate, especially like VA values, and make sure you're giving very specific examples. And so that I would actually, if you're interested specifically in the VA, I would look up performance-based interviewing for the VA. There's things like stewardship or something odd like that, where it's actually talking about considering yourself as a resource and considering limited resources within the VA and kind of how you're addressing those kind of things. And so it's just kind of oddities that once you start to familiarize yourself with it and kind of know what's what, you can kind of start to take your examples and tailor it into what they're asking. But if you haven't looked at any of this, you're going to be clueless in the interview. It's also one of those, technically they're trying to keep pretty stone-faced whenever they're responding. So the whole setting is just very intimidating. But in terms of what I did to prepare for that, I made sure I had the materials. You're actually able to get questions that are saying, like, this is a question that would be tapping into this value. And then kind of start to come up with examples and kind of get creative in a way where you have maybe one example that could fit into 3 different ones if you needed it to, and learn how to hit certain points so that you're tying it all together. And so that's the other piece that I would recommend. Look up what they're looking for and then look up different styles of how to respond. There's the STAR or the SOAR method, where you're essentially kind of structuring your response very intentionally, of organizing what you're going to say, talking about how you addressed whatever the concern was, talking about lessons learned, and then kind of summarizing everything. And so having something like that, it initially seemed kind of silly to me. And then in practicing and making sure that I was very concise and thoughtful in what I was saying, found that to be extremely helpful. So that's on the front end of all that preparation to really make sure that you feel like you have what you need. And then on the back end, finding out that certain settings absolutely require performance-based interviewing. That's what they completely rely on. So my experience with San Diego VA was, that's all they do. You get a 30-minute interview. It's consistent across applicants. And that's your opportunity. And that's about it. Whereas here in Tampa, I did a performance-based interview, but it was one, and then I actually had a whole day of interviewing with other people without performance-based interviewing. So that's kind of the other piece, is figuring out within a certain setting, if you've got somebody on the inside, kind of what will the structure be. I actually asked people that I was kind of coordinating with for the interview, like what should I expect of the interview day? Will there be performance-based interviewing? Just so I could kind of have that stress inoculation in my mind. But that is definitely a VA piece that is stressful, not fun, but something you want to prepare for at the outset so that when you go in, you're not blindsided by it. But VA, it can be anywhere from 30 minutes to a full day of interviewing. So fun.
I would echo everything that Dr. Bannister said about being prepared. For my interview at Kaiser, I had a phone screening, and then I had an interview with the management team in person. And then once I passed that one, I had an interview with the clinical staff for that particular team. So all in all, it was 3. I think that our field lends itself to making us prepared for interviews because we have to do it so often throughout our training career. So I would say just keep that feedback that you get as you go along. Most hospitals will give you a vignette. So being able to answer the vignette in a clear, concise way, being able to answer your questions in a clear, concise manner and not beating around the bush or putting too much fluff in it, just being very clear and succinct. I also would say learn the specific site's clinical personality. Every site has a clinical personality. They either really ascribe to CBT or they really ascribe to psychodynamic. You definitely get a feel from their website what they tend to look for, their buzzwords per se. So make sure that you're familiar with that and identify something specific that site has that maybe other sites don't have in their description of the position or their description of their facility in general, and be sure to speak to that so that they know you're specifically interested in their site and not just the system as a whole. That tends to let people know that you actually want to be at their particular place and why. And then also, as Dr. Bannister mentioned, having examples that you can use to answer questions instead of answering them generally is helpful.
Dr. Brandy here. In addition to everything that both Dr. Jones and Dr. Bannister mentioned, I would echo that instead of reiterating it. I'll speak from the clinical faculty perspective in academia. Generally, you're going to have the phone interview, which is probably about an hour, and these days it may even be a Skype interview. Mine was at the University of Florida. And then following that, the primary interview is about a day and a half. So you're on for, expect about 48 hours, where there's going to be some socializing time, which is informal interviewing. So a dinner with the members of the committee, perhaps an individual breakfast the next day with the director or a clinical director of the counseling center, if that's the particular educational setting you're in. And then a series of group interviews with campus constituents. I remember an individual meeting with our Vice President of Student Affairs. So plenty of administrators, and then the support staff, the clinical staff, your potential colleagues. I know that there has been some mention, this was not the case in my situation, but I'm hearing that this is starting to happen, where there are even student representatives potentially present in group interviews. And then depending upon the specific culture of the center, I believe this was mentioned earlier, like the culture, the philosophy of the setting you're going into. In my case, at the time, there was a lot of outreach and consultation requested. So my version of a job talk was an outreach presentation. What would I do? And so for that reason, in addition to everything Dr. Bannister and Dr. Jones mentioned, I did have to do a considerable amount of research on the student population that I would be doing an outreach for, having never been to the campus. and then the vignette, as was mentioned earlier as well. So it can be a pretty long day. You're eating, you're socializing, but every component of the day is an interview. No pressure. The only thing I guess I would add as far as preparation, in addition to just knowing the site and knowing where you're going and having really thoughtful questions prepared, I would say 2 additional things. One, just to make it a little less overwhelming, one of the things for me was just a lot of self-reflection. What are the 3 things that I want these people to know about me? The 3 things, and how can I speak to those 3 things when it comes to my clinical work, when it comes to my outreach skill set, when it comes to my supervisory skill set? What are the 3 things that I want to speak to and the domains that are most applicable to the job? And then lastly, I would also say, because I know this felt kind of redundant for me, because you're meeting with so many different people, you could literally have the same 10 questions and just ask them over and over again, because you're going to get a different perspective. And so you don't have to feel like, oh, I've already asked that question. All my questions have been answered. In this case, not necessarily, because you're meeting with so many different constituents. So that's my perspective from the clinical faculty role when I was at the counseling center. In my current capacity, I would say you're interviewing all the time. You have to almost create ways of being interviewed, because there is usually no structured interview. So I would usually be the proactive one, seeking places that I wanted to work within or consult within, and then reaching out to administrators on my own, not necessarily responding to a job posting or a call.
Thank you all for sharing that. I'm hearing some consistent themes that I'm just wanting to kind of like summarize and reflect back. One of those, obviously, foundationally, is preparing. And preparing is both knowing a lot of it is knowing about the site. It's knowing how the interview will be structured. It's knowing what folks will be asking you about, and it's knowing about the people that you'll ultimately be serving. Another piece is having some specific examples. I think each of you spoke to this. I think in so many ways that ends up being just a way that you can really stand out. When you have those specific examples, you can really just convey the unique experiences and perspectives that you'll bring. So I just really appreciate you both, all of you, speaking to those in particular. I'm also just wanting to be aware of the time, and so we have one more question that we want to ask the panelists, and then we'll transition to the attendees asking, kind of conveying maybe questions that they may have, and Marty will be asking that of the panelists. But another question that we wanted you all to speak to is, as you were going through the interview process, how did you ultimately kind of make that decision and know that the site or the experience that you have was kind of the one? Like, what was it about? How did you know that?
Mine was pretty simple. It was home.
Yeah.
And so everything else considered weighted pros and cons, it was home, and it just felt gut-wise the right decision.
Yeah.
I would say mine was related to the amount of hours. So I work 24 hours a week at Kaiser, which allows me to do all the other things that I do. So flexibility and scheduling, and then also the population that I'm working with is adolescent substance use. So.
It was a feeling. It was a feeling, my intuition, a feeling, and alignment with my overall career goals, both for my accepting position at the University of Florida, and also related to my decision to leave. It just felt like the right time.
Yep. Thank you all for everything that you've shared, your willingness to kind of express your perspectives and your experiences. At this point, I want to transition it back to Marty and open it up for our attendees for questions that they may have.
Yeah, so at this point, I see the panelists. I see we have a couple of, not panelists, attendees on the webinar today. If there are any questions that have come up for you throughout this talk today, go ahead and feel free to use the chat feature to send those to Ali and I so we can field them to the panelists. At this point, I see that we do have one question, and this is from Richa. And so the question reads, are there any resources available to assist international student interns or early career professionals with navigating career decisions, especially if they are considering returning to their home country in the near future? Do any of our panelists have any perspectives or thoughts related to this specific question?
So as far as the hospital's concerned, there isn't anything specifically related to international students and going back to their home countries. But I do know of a friend who's working in a university counseling center, and there is a lot of support around that in that setting. So I would say it may be beneficial to look in that vein in academia, because there tends to be more support and more direct involvement with regard to international students and transitioning back and forth.
Mm-hmm.
Yeah, I think that's a helpful segue. And admittedly, I don't know too specifically, but what I will say is the best liaisonship would be either your current academic setting, your prior academic setting, and their international affairs offices, even their study abroad offices. The circles are very small in academia, so you're correct in stating that there are actually a considerable number of resources within the academic setting, but I don't know of a general resource for every academic setting, if that makes sense.
Well, I just received a message, and I have an answer to the question that may shed some light on some things. So for general information beyond the academic setting, it seems like you can refer to the International Mentoring and Orientation Committee through Division 17. So once again, that is the International Mentoring and Orientation Committee under Division 17. Supposedly, there was a recent webinar hosted that specifically focused on the job search for international students. So I suggest, Richa, you look into that. Hopefully you can get your question better answered through there. So moving on to the next question, Patricia. So it says, hello, panelists. Thank you for your time. I heard that postdoc was helpful for imposter syndrome, and I'm wondering if you could speak about navigating your imposter syndrome in your specializations or at your sites.
I don't know if I have specific guidance other than just kind of getting the experience and getting to the point that you feel confident enough. I think to some degree it's also been values. I've done a little bit of ACT and kind of just getting to the place that I feel like I'm being values consistent, and then also calling myself on my own perfectionism to some degree. But I don't think I have like explicit do this kind of guidance. It was something that just kind of happened and it surprised me. So I'm sorry if that's not helpful.
That is such a great question. I will just add that, man, that's a hard question. So I would say one of the things that has been most helpful for me, because there's considerable imposter syndrome, kind of anxiety associated with seeking a full-time faculty job immediately after internship, particularly since I went to a non-accredited internship. And I was told initially that was a no-no. So, and it was an incredible experience, but because of that, I felt that I would probably be best suited for a postdoc. What was helpful for me is getting very clear about the kind of experiences I wanted to have at that time in my career, and seeking opportunities that fit that were aligned with that, whether it was a postdoc or a full-time position or not. That became irrelevant. Otherwise, it was too anxiety provoking. And then luckily, in my case, I did acquire a full-time faculty position, but I think whatever would have been most fitting would be fine. I'm not necessarily a proponent of seeking postdoc because of the anxiety that is very natural to feel when you're entering the workforce full time. I experienced and still experience in some ways the imposter syndrome in association with my entrepreneurship endeavors and being in private practice. And it took me a good year to work through some of that. And all that really occurred was the discomfort and anxiety associated with not doing it became greater than the fear and the anxiety of doing it. So I really think just trusting your own intuition and doing whatever helps you to alleviate those kinds of specific anxieties. That's really all I've got for that.
I would also say for you, Patricia, just remember how much training you've gone through. You've been doing this for quite some time. This isn't your first job. All of your training experiences have been jobs.
Thank you all for your answers. I want to squeeze in one final question. So very quickly, this is the final question from Michelle. So she says, great panel, thank you all, happy face. I absolutely love assessment and have done well in graduate school. Is there room for assessment in other settings other than forensics, acute clinical, and child assessment? What do you see is the future of assessment? Are new developments in assessment good or bad? Do you see new things coming down the pipeline? Thanks. And I feel like this question is specifically for Dr. Jones, who has the experience with assessment.
Yeah, I was actually trying to answer her quickly just because I knew time. Michelle, there's absolutely very, very wide variety of assessment opportunities, and you can actually go into a specialization. There are a lot of people out here in California who actually do mobile assessments for the state of California, whether it be for the schools or for community mental health agencies or adults with ADHD. There was a specific ADHD clinic at Kaiser that someone was passionate about that they started, so they facilitated those assessments. So there's great opportunity. It's becoming more at the forefront, at least here in California. There's a lot of talk about it. So if that's something you're interested in, feel free to email me and I can talk to you more.
All right, Allie, would you like to wrap us up for today?
Sure, yeah. I would just want to, I know we've already shared appreciation, so I kind of want to take a step back and reiterate the appreciation that we've shared. Thank you to our amazing panelists for your involvement, for your openness, for your willingness to share your experiences and your perspectives. I know I've learned a lot, and I'm hopeful that our attendees have learned a lot as well. I also want to thank our participants for taking the time to attend this webinar. If it's something that you appreciated and you have somebody in mind who maybe wasn't able to make it, please know that, as Marty shared at the beginning, the video will be available on the Division 17 website. So be on the lookout for that. We also will add to that video a kind of brief PowerPoint that acknowledges some of the kind of consistent pieces across all clinical settings like licensure, ECPP, which of course is just its whole other webinar. Just that way people just not necessarily going into too much detail, but like wanting people to just at least have resources for that. So just so you know that that will be available. As Marty shared at the outset, please reach out to Marty or I with any like pieces of feedback or questions that you may have about these webinars, and be on the lookout for our next one. We're hoping to have one in the coming months, potentially about consulting, which is something really unique that our field can provide and can be a really neat way for us to share our expertise. So again, thank you everyone, and I hope everyone enjoys the rest of their Friday.
All right, have a good one.
Bye, everyone.
Bye. Thank you.
Bye.